What a beautiful day in Arkansas.
Yeah.
Thank y'all so much for joining us. We're glad that all of you could be here, but especially and a huge and big thanks to my very dear and good friend, Secretary of Agriculture Brooke Rollins, who came all the way from D.C. for today's announcement. Now, I know part of it was she was just looking for an excuse to get out of D.C. But Brooke and I survived some tough days working together in the White House during President Trump's first term and bonded very quickly over being working moms and maybe even more passionately over being diehard SEC fans.
Yes, that's true.
Unfortunately, Brooke chose the wrong team, but what she lacks for in team selection, she makes up for in being one of the toughest and most dedicated public servants that I've ever met. Brooke isn't just brilliant on policy. She's from a farm family and cares deeply about the history and the future of the agriculture industry. And I know that she's working every single day to make our ag community stronger and Americans healthier. I also want to thank Secretary Christy Putnam, whose team put an enormous amount of work into the announcement that we're making today, and who has been a tremendous leader for all of our team at DHS. This past December, I sent a letter to the incoming Trump administration announcing my intent to reform Arkansas's food stamp program by banning unhealthy foods like soft drinks and candy. Today, my administration is submitting a first-of-its-kind waiver that will allow us to do just that. America is facing a chronic disease epidemic. Obesity, diabetes, heart disease, and other chronic illnesses are a personal struggle for millions of Americans and driving significantly higher costs in our healthcare system. Sadly, Arkansas statistics are even worse than the nation as a whole. 1/3 of our state has diabetes or is pre-diabetic. When the numbers are that high, it's important for us to examine a system that actively encourages and subsidizes unhealthy, highly processed, addictive products. Right now, you can use food stamps to buy a soft drink or a candy bar from a gas station, but you can't use them to buy an Arkansas-raised hot rotisserie chicken from a grocery store. That's the definition of crazy, especially when our state has so many farmers and ranchers raising healthy, homegrown products right here in our backyard. Luckily, we finally have a president who, along with Secretary Rollins, has put a laser focus on solving America's chronic disease epidemic. I believe that reforming food stamps is a great place to start. Our country spends $119 billion each year on food stamps. 23% of that spending, which is $27 billion annually, goes toward things like soft drinks, unhealthy snacks, candy, and dessert. At the same time, our state Medicaid program spends at least $300 million each year treating chronic illness. Taxpayers are subsidizing poor health. We're paying for it on the front end and the back end. That's not a nutrition program. It's actively harming Arkansans' health and contributing to our nation's mountain of debt. One Stanford study estimated that just by removing sugary drinks from food stamps, we would prevent obesity in 141,000 kids and type 2 diabetes in 240,000 adults nationwide. I want to be clear, though. This is not about taking anything away. The government isn't dictating what you can or can't buy with your hard-earned money. It's simply saying that taxpayers are no longer going to cover the cost of junk food like candy and soft drinks. Instead, those who rely on food stamps can use them to buy healthier, more nutritious foods. This is a first step in what I hope will be a broader conversation about the food stamp program. In Arkansas, we will be using the GS1 U.S. categorization model to make this reform easy for retailers to adopt. Easier to implement than say, apparently, but I know through my conversations with the beverage industry that they are working to address health concerns by working on healthier, affordable options. And we hope they will continue that work, and we look forward to working with them on it. In our waiver, we are also requesting to add rotisserie chicken, an affordable, healthy protein source, to the list of approved SNAP items. We plan to use SNAP dollars to expand nutrition education in our schools, and we will look to make additional changes to the program in the future. We want to encourage healthier lifestyles for our state because we know it's important to our economy, but more important to Arkansas's quality of life. We understand that food security is a real problem across the country, which is why we work to make Arkansas the first state in the South to offer free school breakfast to every student, and why I signed our state up for a second year of summer EBT so kids have meals during the summer months. We need to end the perverse incentives in our food, healthcare, and welfare programs that make America the least healthy developed country in the world, spending the most on healthcare and receiving far worse outcomes than all of our counterparts. Like so many other conservative reforms, Arkansas will lead the way. And I'm thankful that President Trump, Secretary Rollins, and the rest of the Trump administration are working with us to implement these common sense conservative reforms. I'll now turn it over to Secretary Rollins, and then Secretary Putnam will come up and deliver remarks, and then we'll be happy to take a few questions. Thank you so much.
Wow, what an awesome day here in beautiful Arkansas. I was in Pennsylvania yesterday, headed to Lubbock, Texas tomorrow, moving into Ohio and North Dakota and several other states in the coming weeks. But of all of that, to be here with all of you today and with my sister from a different mister, Sarah Sanders, we did have an extraordinary time in the first White House under President Trump. And Sarah, to see you lead with such boldness and courage and poise and elegance and intellect is truly inspiring. So happy to be here in your backyard, the people of Arkansas's backyard, on this beautiful morning. In a state like Arkansas, and with Arkansas leading the way, that has done so much to exemplify the virtues of productivity, of innovation, and of compassion in everything that you do. There's a reason that Americans from all over the country come to make a life in Arkansas, and it's a tremendous credit to my longtime friend, Governor Sarah Huckabee Sanders. We're here today, as she mentioned, to announce the Arkansas SNAP waiver program, one of the first in the nation, and an example of the kind of innovation that the states are uniquely positioned to effect. Although SNAP, or food stamps, is a federal program, we administer it in partnership with the states because it is in the states, and the states who are the closest to the citizenry and understand best the needs and expectations of your people. No federal bureaucrat can do that, nor any program in Washington, D.C. So let's understand one big thing first, that what we are doing here today is affirming the value of federalism in all aspects of governance. That's why I am here. That's why I want to applaud my friend Governor Sanders, who has once again exhibited the courage and the innovation of the people that she represents here in this great state. The SNAP program is designed to help those in need of assistance, not to hurt them. And it's also funded by the American taxpayer, who deserves a say in how the program is administered and what the program funds. President Trump has given his administration, our administration, the mandate to make America healthy again. This is one of the things he campaigned on, and this is what the American people voted for. And I venture to say, especially the American mom voters, like myself and Sarah and Christy behind me. The American people have spoken, and the people of Arkansas have spoken, and Governor Sanders is once again leading the way. And the American people are asking, how does it make sense that SNAP will pay for unhealthy sodas, for candy, and for junk food, but not for rotisserie chicken? 40% of school-age children and adolescents in the U.S. have at least one chronic health condition. Think about that. 40% of school-age children and adolescents in our country have at least one chronic health condition. Prediabetes now affects 1 in 3 children ages 12 to 19. This is a crisis and was the greatest contributor to the U.S. healthcare costs, and now comprises 90% of our expenditures, according to the CDC. This cannot continue, and certainly not under President Trump's watch. The system is broken, and to do things the way we have always done them is no longer acceptable in Washington, D.C. I stand here today, made the trip today to Arkansas to support this amazing state and your incredible leadership in the next step, and in doing so, encourage all the states to also consider different ways of doing business to make our citizens, our country, and all Americans healthy again. We at USDA are committed to funding health, not illness, to satisfying hunger with nutritious food produced and harvested by our incredible farmers and ranchers here in America, but not unhealthy food products that fuel chronic disease. Congratulations to Governor Sanders and the people of Arkansas for taking a historic and leading step toward restoring health in our great nation. Thank you.
Well, good morning. I'm so grateful to be here today for this important announcement. I want to begin by thanking Governor Sanders for her leadership and steadfast dedication to improving the lives and the health of all Arkansans. And I want to thank U.S. Secretary of Agriculture Rollins for her support as we implement these innovative changes to the SNAP program. And it means a lot to all of us that you all were here in person today. The changes we are making to SNAP are really about one thing: bettering the health of the citizens we serve. For too long, we have used taxpayer dollars in SNAP to buy foods that not only have no nutritional value, but are actually drivers of chronic health issues like hypertension, diabetes, and obesity. In addition to SNAP, the Arkansas Department of Human Services also administers the Medicaid program. So in one program, SNAP, we've subsidized foods that we know make people less healthy. And in the other program, Medicaid, we're devoting resources, significant resources, to treating the same health conditions brought on by consuming unhealthy food. This makes no sense. Everything we do at DHS should contribute to improving health. I have a saying about how we serve people. The individuals and families who come to us don't come to us in pieces. So why do we serve them as if they do? Why do we contribute to poor health in one program and then try to fix it in another program? There's a better approach, and it's why we're here today. It's about prevention. It's about healthier choices, so Arkansans all across the state never develop those conditions to begin with. And it starts with the common sense changes to SNAP that are outlined in our waiver. More than 100,000 households across our state receive SNAP benefits every month. This new approach will mean more nutritious options on the table of each one. This isn't punitive, it is preventive. It's about making a positive difference in the lives of people we serve, and I couldn't be more excited to be here today announcing this next step. Thank you all very much.
Thank you very much. We are obviously excited about the progress and the implementation of this program, and glad that we have the opportunity to be here with you today. If there are any questions, we will certainly take a few. Just to make sure that I'm hearing your question correctly, are you asking why we're adding rotisserie chicken in? That's a really good question, one that you would have to ask the federal government who originally created the program and excluded it. It doesn't make good sense to us, which is why we've asked that it be included in the waiver that we're putting forward today. Things like a high protein homegrown food that aren't included, however, candy and soft drinks are. And so that's one of the big things that we want to make sure we change.
Let me add, it's such a great question, and I think it goes directly to the heart of what this administration is working to do in Washington. Within the first hour of being sworn in to my role on February 13th, a little over 2 months ago now, we sent a letter to all the governors. I think Governor Sanders was the first one to respond, saying it's a new day at USDA, and it's a new day in Washington, and we are going to be returning power to the people, which means relying on our governors, both Republicans and Democrats, to come up with new and better ways to effectuate these programs. No child in America or Arkansas should go hungry, but there has to be a better, more efficient, more effective way to implement these programs. And of course, Governor Sanders was one of the first to step up. I'd be remiss if I didn't note that at this very moment in Indiana, my partner, Secretary Bobby Kennedy, is doing a similar event with Governor Mike Braun in Indiana with a very similar and aligned effort and vision, but what's best for Indiana. And we see more governors following the leadership of Governor Sanders. So to your point, these are the questions that must be asked and answered, and best answered by the elected officials and the leaders that are closest to the people in our founding fathers' vision of how to effectuate an effective government.
This is a question for Secretary Rollins. Actually, two questions. First, is Arkansas the first state to submit a waiver like this with restrictions? And second question is, how do you respond to the criticism of these limits that they further stigmatize people on food stamp program?
Well, first of all, thank you. Governor Kim Reynolds out of Iowa submitted a smaller waiver regarding summer programs, but this is certainly the first that will have been submitted since we took office a little over 2 months ago, specific to the larger and broader implications of sugary drinks and junk food, et cetera, being paid for by SNAP. At the end of the day, we will never restrict choices of you, of myself, of others. What we're working to do is make sure that taxpayer dollars, that when government is involved and when they're spending the money of our people, that money is being spent wisely and in the best way we know how. I think Sarah mentioned in her numbers, this is an over $100 billion program out of USDA across the country. The largest spend of that $100 billion for those who are on these programs is not on fruit or vegetables or protein or rotisserie chicken or whole milk. It's on soda. So clearly, when you look at that from the front end and how we're spending taxpayer dollars, and then the back end, as Secretary Putnam mentioned, the cost to the American taxpayer in terms of chronic disease, in terms of the amount of money we're spending in Medicaid, et cetera, something has to change. And I do think it's worth noting that when Secretary Bobby Kennedy became part of the last campaign when President Trump was running, I think he joined in August, he brought an energy and a focus and a vision to the conservative side of the ledger, saying we have to do something about how unhealthy our country is. When 3 or 4 out of 5 kids are pre-diabetic in America, that is not okay, and the disservice to the future of our country, not just to the taxpayers and not just to those families, but to the strength of America. Something has to change, and I think you saw a reawakening of how important that is. And I know, again, I'm the mom of 4 teenagers. Of course, you all know Governor Sanders and her 3 beautiful children. Secretary Putnam has 3 children as well. Listen, I don't mean to disparage any of the dads out there, and certainly dads care about nutritious eating too. Probably have a story about how, we hate dads here, but it's not about that. But it is about being able to feed our children in the best and most nutritious way. So for anyone that says that, oh, we're taking choices away from moms who are trying to just put food on the table, that could not be further from the truth. We are doing everything we can to empower, especially our disadvantaged families and our disadvantaged moms, so that they can have the opportunity to make better choices. And be clear, this is not taking any money out of these programs. The levels stay the same. It just opens up the opportunity to buy better and more healthy food moving forward.
Sorry, we were playing Mike over here. A question. You mentioned that the levels are going to stay the same with SNAP, but when you're talking about more nutritious foods, it was a worry in the community about not able to, extend those dollars even more, because when you're going nutritious, that can be a little more costly. How are you going to deal with that, or what's your response to that?
I think there's a couple points here. First, I think you'd be hard-pressed to say that you're going to be better off having purchased a pack of Skittles and that your hunger is going to be satisfied after that purchase. We want to encourage people to make better, healthier choices. Again, not take anything away. It's also why we've worked really hard, and there are a lot of legislators that are sitting here to remove Arkansas's grocery tax so people have more and more of their hard-earned money to buy food here in the state of Arkansas. I think one of the big things that is regularly lost about the SNAP program is that the N in SNAP stands for nutrition. And we have taken a program that is meant to be about providing and helping people put food on their table and put something else in their hands and in their stomachs. We have to do a better job. We know that we have an absolute epidemic, and there are a number of ways that we're looking at addressing that, and those are just a couple. But to make an argument that this is somehow a disadvantage, I think is a real disservice to the people of the state.
Hi, Governor Sanders and Secretary Rollins. This question's for both of you. I think a lot of people are going to be really proud of this announcement to help SNAP beneficiaries eat local foods like rotisserie chickens grown here. But recently the federal government cut the LFPA program, and there were cuts to the federal local food for schools program as well, which farmers were getting paid by the government to grow local produce for their communities. And a lot of farmers have been hurt by those cuts. And so how do you reconcile this, on one hand, trying to help people buy local food from our farmers who are really struggling, and on the other hand, cutting these programs that are really important for farmers?
Well, thank you for asking that. Let's be very clear. In the 2 months since I was sworn into office, we have directed $1 billion into food programs in local community food banks, and that doesn't even include the school side of it. The school side of it is run by Department of Education, but $1 billion. The sort of lefts and the left-wing media that has made this whole narrative out of, oh, USDA hates poor children and, oh, they're cutting all of the food programs, just isn't true. The programs that were pulled were ones that were forward leaning. They were COVID. They came about during COVID, and there were billions that were spent out, and there was a lot of money left. For example, I was in Pennsylvania yesterday. Pennsylvania, and in every single stop, I got asked this question. In Pennsylvania, they have $30 million still sitting in an account to be spent on local food programs and buying nutritious food from farmers. I haven't looked at the Arkansas numbers. I should have done that before I walked up here. But across the country, there's so much taxpayer dollars sitting in those accounts that is waiting to be spent. Again, the money that was clawed back was a Biden-era COVID program that was never meant to be long-term. It was only meant to be during the COVID era. So working to realign USDA, working to realign every taxpayer dollar around what is the best, most effective spend, but also understanding that under this watch, under President Trump's watch, we will not let children go hungry, that these programs will be well funded. They're just going to be more effective, more intentional. We're going to pull the fraud out, and we're going to ensure that the promises made to the American people are kept.
Time for maybe one more.
When will the waiver be approved?
Well, we hope really soon. Would you like to see if she just signed now? Because that'd be fine with me. Obviously, it's a process. Arkansas's waiver has a voluntary 30-day comment period that's not required, but it was something that we felt like was important to include in our request so that we have the opportunity not only to hear from stakeholders, but to work closely with USDA on the finer details of that request. But we're hopeful that this gets done very quickly. I think if you've learned anything about the Trump administration in the last couple months is that they're not sitting idly. They are moving fast, and that's something we love, and one of the reasons that we're excited to work closely with this administration.
Yeah, y'all will appreciate, to Governor Sanders' point, that the waiver is officially submitted today, which is why I am here. And by the way, a lot of people said, oh, Brooke, you shouldn't go until, maybe for an approval and not, not when it's submitted. I said, no. This is such a big deal. It's such a big day. I'm so proud of Governor Sanders and her team for stepping into the gap, for being bold. We'll get the waiver through the process, but to the point on timing, it gets submitted today, and I think our teams at USDA and in the governor's office already have a conference call scheduled for tomorrow morning. So it should move very quickly, and everything we're doing, we're trying to move very efficiently, very quickly, and move these important changes out to the rest of the country.
Thank you all so much.
Thank you, everybody. Great to see you.